my name is Suzanne Fenske. I'm Assistant Professor of Obstetrics, Gynecology, and Reproductive Sciences at Mount Sinai. Endometriosis is a disease where the endometrium, which is the lining of the uterus, implants in other places in the pelvis. So often it's found by the ovaries or by the uterus. It's a disease of estrogen and inflammation. And it feeds off of estrogen, which is why it's a disease during your fertile years and why it doesn't manifest before you get your period and goes away with menopause. Symptoms of endometriosis are painful periods, pain with intercourse, and infertility. Not all women have symptoms of endometriosis. That's usually what will eventually bring them to their doctor, are those symptoms. So endometriosis can be treated medically sometimes. Often it can be treated with birth control pills or injections or other medications. And then if a woman still has symptoms regardless, then surgery would be the treatment. So the biggest issue we're having is that endometriosis takes a long time to diagnose. For most women, from the beginning of their symptoms, it's about 8 to 10 years before they get a diagnosis of endometriosis. So I encourage women that if you're having painful periods where you're missing work, missing school, that's not normal. You should speak to your doctor and hopefully get an earlier diagnosis than waiting that long. But often women believe that having painful periods is normal. That's what a period is. It's painful. For a lot of women, the reason why they get diagnosed is because they're trying to get pregnant and they're unable to get pregnant. So eventually the steps lead down to being diagnosed with endometriosis. The other reason why there's such a delay in diagnosis is because women who have pain with intercourse as their symptom of endometriosis are probably embarrassed or feel that they don't want to have that stigma attached and don't really speak about it with their partner or with their provider. What we offer at Mount Sinai is the ability to take care of a patient from the beginning to the end. Even if they come with a diagnosis of endometriosis, we're able to treat them medically, offer them surgery, depending on what stage they're at with their endometriosis. What separates us from other institutions or other doctors is that we do work together. We work with colorectal surgeons, psychiatrists, sex therapists, pelvic floor physical therapists, and we're able to work together. If there needs to be a surgery, we have the specialists for the possible bowel surgery. We have the specialists for the gynecology surgery, the specialists for the urology surgery, who are able to offer the patients the best surgery possible. Besides surgery, we also are able to help a patient live a healthier lifestyle with endometriosis, working with dietitians, working with sex therapists, and in all the ways that endometriosis can affect their life.